At times, following an automobile accident, unfortunately, we sometimes sustain physical injuries, which leads to stressful legal matters. Many times, it doesn't matter if we yell from the top of our lungs that we have pain. All that matters is objective proof of our injuries. Hello, I'm Dr. Pak, and I'm going to talk about impairment ratings and how it may help further validate and prove a case for automobile injuries. First, what is an impairment rating? It's a calculation to determine how bodily injury affects a person's ability to perform normal daily activities, such as bending, walking, sitting, and so on. And for the most part, an attorney is trying to determine the severity of a person's bodily injuries, and with impairment rating, a percentage can be calculated. For example, if we are in the perfect healthy condition, we are at 100%, but due to an injury, if we have an impairment rating of 10%, we are no longer considered to be at 100%, but instead at 90%. And this rating can then be in turn used to help quantify a person's injuries and be used to help with their legal matters. However, not every injury requires an impairment rating. It is dependent upon the type of injury that the person sustained. For example, chronic recurrent injuries, disc herniations, post-operative conditions, spinal stenosis, fractures, and dislocations are some of the conditions that qualify for an impairment rating. Many times, people are diagnosed with the general whiplash syndrome. Normally, this type of diagnosis is not specific enough to warrant an impairment rating. Therefore, more specific testing may be necessary to have a more detailed and accurate diagnosis. So what is necessary to have an impairment rating performed? First, the doctor will need to perform a detailed injury history, which will include a functional assessment. Secondly, a thorough physical examination should be performed, which includes range of motion, orthopedic tests, palpatory tests, muscle tests, reflex tests, and sensory tests. Thirdly, they may have to refer out for further testings, which may include MRIs, CTs, X-rays, EMG, bone scan, and so on. Fourthly, there needs to be a course of treatments, which may include medicine, chiropractic, physical therapy, injection, or even surgery. And after completing the prescribed course of treatments, but yet continue to have pain, functional limitations, or work restriction, or a person's quality of life has decreased, only then should an impairment rating be performed. And only then can a doctor declare that a person has reached maximum medical improvement, and therefore their injuries are declared permanent, and preventing a person to be at 100%. A word of caution. One must understand that this calculation will be with them forever, because the very purpose of an impairment rating is to determine an irreversible permanent condition, and also it may affect a person's future employment, such as joining the military, law enforcement, or any job that may be physically demanding. Therefore, no doctor should assign an impairment rating without giving a person a full explanation of the impact that it may have on them. An honest, concise narrative report with detailed impairment ratings can help explain a person's injuries and help them to prevail in their legal case. So if you've been involved in an automobile accident and sustained injuries from the accident and have questions, please feel free to email me at info@echiroplus.com or call us at 678-610-7587. Thanks so much for listening.